Hey everybody, it's Katie. Today I want to talk about preparing the twins for lactation, for breastfeeding after you have your little baby. As much as you might think that it should be as easy as just plugging them in and then there you go, unfortunately, many times it's not quite that simple. So today I want to talk about some suggestions and some tips that worked really well for me for before you have your baby and then after you have your baby. I have two daughters. One is 6 and the other one is 2. My firstborn I nursed until she was 3.5. Yes, some of you might be like, 3.5, oh my gosh. But I'm a little hippie that way and I don't really care. She liked it, I liked it. And then when we were done, I bribed her with cupcakes. And then my secondborn is 2 and we are still nursing. And of course at this point, I realize it's less about the nutrition and all that and more about the comfort. I do know that there are still some health benefits in nursing her. And when are we going to be done? I'm not sure. And as much as I am excited to be all just mine again, it's okay. I don't mind. She is happy and I'm happy. So we'll get there when we get there. And it wasn't just as easy as, I have this baby, let's plug her in and everything's going to be fine and we'll be nursing. And there are complications that come along with it. And I don't know why. That'll be a question I have for God later on. But fortunately, I was given advice early on in my pregnancy to seek out advice and support. That way, when the time came, if I need it, I wasn't going to be bleary-eyed and ridiculous and sleepy and trying to figure out how to feed my baby with boobs that are about to bust. So that was probably one of the best pieces of advice I got, was to prepare. So today I want to talk about a few things. First, I want to talk about things to think about and consider and kind of get in line before you actually have your baby. These are things that you don't want to do after because it might not work very well. And then I also want to talk about what to do after and kind of what to expect and that type of thing. I was told early on that when you have your brand new, fresh little baby, to be careful what you allow them to have in their mouth. I had my first daughter at a birth center and my second daughter in my bathroom, which was an accident. So I didn't really have to worry so much about anyone giving her a bottle, a pacifier, sugar water. I don't even know if they still do that, but I didn't have to worry about that because of the area that we were in. However, I was aware of it and I was very careful in the first few weeks to not give her a pacifier, simply because I wanted, when something was in her mouth, I wanted it to be my breast, and so she would kind of learn how to latch to that and not to something else, because believe it or not, actually, there is such a thing as nipple confusion, and if there's a bottle and then a breast, and you want them to take the breast, most of the time, that's what I would start out with. And so for the first few weeks, they're pretty much a bump on a log anyway, and they'll sleep on the drop of a hat. So you don't really actually need to worry too much about a pacifier. And if your babies are anything like mine, both of my girls were like, pacifier? Pfft, what is this? Get that out of my mouth. I don't sleep. I don't need any of this. Yeah. So fortunately that changed, that settled down a little bit. But so that's the first thing, is decide on how you feel about that. Do you want them to have a pacifier and do you not? Maybe read up a little bit about nipple confusion and what that looks like really, really early on, like as in the first few weeks or so. The next thing I would suggest to do before delivery is look around for support networks. There is an agency called the La Leche League, and it's nationwide, probably actually even worldwide. You can look around and you can find out if there are any of these leagues in your area. There's also lactation consultants that you can find online. You can go, there's businesses. A lot of times if you deliver at a hospital, they will have a lactation consultant that is kind of part of the hospital, or they have their own, like in my case with the second baby, it was billed through the hospital, but it was a separate location. So do your research, look around, find a lactation consultant, and maybe even potentially reach out before the baby's born, especially if you know that this is someone who's going to be within your insurance provider. And then have their number written down, put it in your phone, put it wherever you need it, to where if you come home with this baby and you're bleary-eyed and you're having problems and baby's doing weird clicking things or screaming things or arching and crying or refusing to even latch, which is unfortunately all a possibility. That way there's not this sense of panic like, oh my gosh, my baby's going to starve, I don't know what to do. You pick up the phone and you call the lactation. Also in that vein, if you have anyone in your life, a girlfriend or someone who you know, a female that's breastfeeding currently and you're pregnant, go spend time with them and ask them, hey, without being really weird, can I watch you feed your baby? Can I ask you some questions? Because unless it's something that you've paid attention to in the past, at least in my experience, of course I knew what breastfeeding was, you put your baby on. I didn't realize beforehand that there was a special way that they needed to have their tongue and that a way to hold them, and I didn't know all those things. And so to be around nursing women was really helpful because I could hear their stories and they could explain like, hey, it might be difficult, it'll get better, but I could also watch what they were doing without, feeling like a weirdo because these are my friends. The next thing I would suggest doing before you have your baby is get your stock built up. Get some nursing bras. Get some pajamas that have easy access. And they don't even actually have to be the fancy one with the hooks there. It could just be button jamas because you might actually not really want to have those. But there are nighttime nursing bras where it's really easy. All you gotta do is just kind of slide it over and attach the baby. So get those because it gets really old if you don't have a nursing bra and you're trying to wear a regular bra or a sports bra, because then you're lifting it up, your boobs are getting smushed, and especially early on, that's going to push into your breast, which is going to make your milk squirt out faster, which is going to gag your child and make them angry. So, lesson learned. Get a couple nursing bras. They don't have to be fancy, they don't have to be special, but get something where there's the little click at the top and you can kind of pull it down. Those are important. They actually have pretty nice looking nursing bras too if you want something, if you're going to work or you just don't want to feel like a moo cow and you want to have something pretty. They do have pretty nursing bras that are kind of lacy and that type of thing, have the underwire and all that. But get some nursing bras, get some nursing pads, because at least in my experience, the first few weeks probably there was leakage. Now part of it might have been because the baby was next to me. She slept with me. Actually, both my girls slept with me early on because it was just way easier with how often they wanted to nurse. But when the baby's on one side, then the other side's like, oh yes, me too, for the twin that doesn't exist, and you've got the dripping, and then you're like, cool, the bed's wet. So the nursing pads are kind of nice to have because you can kind of at least stop some of that flow there. They also have these special nursing pads. They are made out of silicone and they look like a giant contact. So they're kind of like this. So you fold it and you push it on and you set it right on your breast, and it actually will keep the leaking at bay. We'll put some information about them in the description below, because those saved my life when I started going out in public, because sometimes you leak enough where you leak through your pad and then your shirt gets wet, which is awesome, especially when you're out and about. But these ones kind of saved my life. So those were really helpful. Another thing I'm going to suggest to have on hand is a bag of peas or an ice pack or a gel pack or something, because at some point in time, it's entirely possible that you will get engorged and they will start to hurt. I can remember with my firstborn falling asleep with gel packs, with ice packs, of course towels and stuff on both sides, a little teary, wondering if my boobs were ever going to figure it out, and it was not nice. But knowing that this is a potential early on probably would have helped my feelings a little bit. In fact, with the second one, I was ready. I was like, I've got the ice packs, I've got them all ready to go. I made some special ones. Didn't ever actually end up needing them, but my heart was a lot more prepared for it. So stock up, just understand that they might get engorged a little bit and you can put some ice on them, or cabbage leaves, hippie, but it might work. There's also going to be a link in the description below for some of this as well. But just understand that engorgement is a possibility. It's okay, your body will regulate, but just be prepared for it. Those items that I just listed are probably the things that's imperative for you to have. There's a few other things that I would suggest that will just make the process a little easier, but you don't have to have them. So one would be a rocking chair, a nursing pillow, as well as maybe just a few other pillows that you dedicate to nursing, a breast pump, which if you contact your insurance company, a lot of times they will actually either send you a breast pump or they will pay for a breast pump for you. Some storage bags, that way if you want to pump a little bit, you can have that. Also, if I didn't say this earlier, this is super important and you want this, and that is the lanolin cream. I didn't mention it. You want that. This is not a suggested, this is a you must have. Get the lanolin cream for your nipples. Trust me, you'll want it. It's safe for the baby. It will help a lot. So you definitely want the lanolin. So those are a few of the items that I would say would make your life much easier. They're not required. They're not super important, except the lanolin. That's important, but they will make your nursing relationship quite a bit easier to have those things. Okay, so now we have reached the point in the video where I want to talk about after having the baby and kind of what that's going to look like in terms of breastfeeding. I think that it's probably pretty common, although I've never delivered in a hospital, even though I meant to the second time around. I don't know, but I think that it's fairly common that immediately following birth, I think the baby's placed on your chest. When I delivered in the birthing center with my first, after I had the baby, they actually put her on my tummy, and I was thinking in the back of my head, what are you doing? And they were like, no, it's something about testing the vigor, I don't know. But she actually army crawled this little tiny bump that had been, out of the womb for about, 20 minutes. Basically army crawled up and nuzzled around until she found the breast, which I thought was probably one of the most amazing things I've ever seen. It was so cool. I thought, what are you doing? This poor thing. But she knew, right, what to do. She's like, I got this, Mom. So, but I think it's pretty common that most places, after you have your baby, they are either going to place the baby directly to your chest or they're going to put the baby on you. And then, so baby's right there. Get on it. Let the baby try to attach. And maybe it might not want to right away. My second born was not quite so interested. Kind of fitting for her personality, actually. I'm not interested right now. I'll do it when I want to. But she did it fairly quickly after. She did end up latching. And so that's the point, is get on it pretty quickly. Let it happen like ASAP and be available in those first few days anytime they want to nurse or anytime they're nuzzling or bobbing their little head or whatever. Just let them nurse. The next thing I would suggest doing after you have the baby is, whether you are at home, you're at a birth center, or you're in a hospital, keep the baby with you. And I don't actually know for sure if they still take the baby to the nursery. I don't know. I think that most hospitals are starting to understand the importance of having baby right next to mama and acting accordingly. However, if you're in a place where they are wanting to take the baby away, say no, and keep that baby right next to you. When I had my second daughter, she was, as I mentioned earlier in the video, she was born at home, but we had called 911 because we were not anticipating a home birth and we didn't have any support with us, and she came really quickly. So the ambulance came. She was already out. My husband delivered her, but they took us to the hospital to check her and to check me to make sure there wasn't any bleeding, because I did have a little bit of a bleeding issue with my first. After they got done doing all the testing and checking and everything they needed to do, we got into our room where we were going to stay the night, and they brought in this little crib, and it had clear plastic sides. I think that was where the baby was supposed to sleep the night. Now, if that's where you want the baby to be, cool. But for me, I was like, no, the baby will be right here next to me. I will keep the baby very close for easy access. And that first night, she actually slept quite a bit. But the point is, having her right next to me, easy access, smelling me being close to her, and her wanting to nuzzle and to nurse. And the last piece of advice that I would give to you, and I kind of dealt with this with my first one, I did not heed it accordingly. Everybody always says, oh, so you sleep when the baby sleeps. And I was like, yeah, right, I'm gonna go clean my kitchen, or I'm gonna go clean my living room, or I'm gonna go do something adult-like that doesn't require poop and drool. I did that much differently with my second one. But when people say sleep when the baby sleeps, do it. When the baby sleeps, take a nap. You need to get rest, because if you don't have rest, you're going to crash. So you have all these adrenaline rush, you have this giant rush, and you've just had this baby and all this, and you're like, I don't need to sleep, I'm good. but you will crash at some point in time. So to avoid that crash, because then you're playing catch up. So to avoid the crash, I would say, as hard as it is, sleep when the baby sleeps. And fortunately, newborns sleep a lot. So you'll have chances for naps, and you can do something a little bit later in the day. Looking back on it now, it's a sweet time period that will go away pretty quickly. So in the grand scheme of things, just take a nap with your baby. It'll make you feel a lot better. If you like our video, please click like. If you know of anybody who is a brand new mom or about to be a brand new mom with an earthside baby, I would be honored if you would consider sharing the video. These are things that we need to know about, and sometimes, unless we have people in our ears telling us, we don't know about them. So I would love it if you would share it to help prepare other mamas on this journey as well. We have a Facebook page and we have a blog, so we'd love to have you join us there. And lastly, if you're not a subscriber, I'd like to invite you to be a subscriber. If you click on the little subscribe button, you will be notified when we do new videos, which is every week. We drop a video every week, so we would love to have you join in with us on our journey to family. So you guys have a great day, and we will see you next week for our next video. Bye.